We mentioned this story yesterday, and of course now we're in a situation where both Natasha and I have had COVID. So we're now dealing with issues. I have a loss of smell and taste. And you're now beginning to experience that. And I had mentioned yesterday when we talked about this story, I didn't think that was serious enough to be considered long COVID, because we've heard of people with really bad situations where they have difficulty still breathing, or they have brain fog on a regular basis. Some can't even get out of bed. We thought, well, that's serious. But there is a study now at McGill that is looking at long COVID, because we now know that about 10 to 30% of Quebecers who've had COVID still have lingering symptoms after the illness. So we wanted to find out more. Dr. Leslie Fellows is a neurologist specializing in cognitive disorders and a professor at McGill, and is on the line right now. Dr. Fellows, thanks for the time.
Hi, great to talk to you.
Can you, I gave kind of the broad sense here, 10 to 30% seems like a big numbers considering how many Quebecers that represents. So what does your study specifically involve?
So I agree, it's a big number, and it's a number based on, wild estimates that vary depending on how you define this condition, or probably set of different conditions that are kind of lumped together informally as long COVID. Our study is really trying to come at this from the point of view of people who are having symptoms that they think may relate to COVID, that are extending more than a month after they got better from the infection. Really to try to understand what's the range of these symptoms, what are their impacts on the person, what are the most problematic issues from their point of view, and what's the evolution over time? How do these things change with time? In most cases, are they getting better? Is there anything we could do to accelerate those getting better states? These are the kind of questions that we feel need more information. We're short on information, and so that's why we're doing research to have people help us understand what's going on.
I described a couple, like brain fog. That's the one we typically see. Can you identify a few others that are typical symptoms of long COVID?
Well, again, it depends on who you ask. You mentioned some of the more common ones, change in taste or smell, fatigue, trouble concentrating, or so-called brain fog, anxiety, or other kinds of mental health symptoms, trouble breathing, headaches. But really, there's a long list. If you ask people for symptoms, you can end up with a list that goes on past 100. That's one of the challenges, is are these things really all related to COVID? How? Why? How can we get a better grip on it is really the underlying question of our research.
Okay. But I love that this is taking it seriously. So my mom's a long hauler. She's in pain. Well, you never know on any given day what symptoms might present for my mom in particular. It's been 2.5 years. And what her biggest frustration has been getting anybody to listen, getting people to truly treat it like it is an actual thing. That seems to be happening now. There seems to be quite a serious shift where, not just being ill-equipped to treat the symptoms, but just accepting that this is a real thing. Long COVID does exist. Have you felt that shift?
Well, it's interesting to see the evolution of our understanding of it from the medical point of view or a research point of view, and then the evolution of kind of how the public is thinking about it, or how people who have these symptoms are thinking about it. It's actually, in a way, fascinating, but not so fascinating if you're actually living with the symptoms. To give it a name, it makes it sound like it's a disease. I think it's more likely that there are many factors that lead to people having long-standing symptoms, sometimes very severe issues, as you were both mentioning. But of course, we have to take seriously, regardless of what the causes might be. If people are having difficulties, if their lives are being affected, then we have to figure out what can be done to help them, and hopefully understand better what the underlying causes are at the same time.
Can we? People
you're
listening
giving me
to
a clear
this.
picture that it's very.
I'm just saying, people listening to this, you mentioned your mom, but I'm thinking other people who are listening to this or in a situation like this are thinking, okay, maybe what I thought was a symptom or I didn't think was important enough to be looked at. Are you looking for anyone who wants to join this study to join this study?
I think if people think that they have symptoms that relate to COVID that have stretched on more than a month, we're interested in hearing from them, really to try to get a sense of the spectrum of severity. I think sometimes the media and perhaps also in clinics are seeing kind of the more severely affected people. But we're interested in the whole range. So if people are interested enough to engage with us, we're happy to get their input. The study is completely online, so in that sense it's a relatively lightweight experience. You can log into our website and answer questions about your experience. And we're happy to hear from you if you think your symptoms relate to COVID.
Okay.
I was going to say before, Dr. Fellows, you kind of paint a picture of how, like the spectrum that you're talking about. This must be pretty daunting because you're going to be hearing such a huge, vast variety of different things that people their ailments, right? Are you a little daunted by all of this?
I'm a little daunted. I have a great team that I'm working with expertise, in everything from rehabilitation to psychiatry to infectious disease. So in the sense that I think we're well prepared to try to help. The team actually has worked in the past on other health conditions that also have chronic and complicated sets of symptoms. So we're accustomed to trying to sort out complexity. I think this particular situation may be especially complicated, but the one thing we know is we can't do it without hearing from the people affected. So that's why we're kind of going directly to the public to get people to help us try to understand. Will it be possible to tell very neat and tidy stories about this? Not sure, but we'll do our best, and we're taking a very holistic kind of big picture approach to it. This is a starting point, really, to just try to get the lay of the land, and we hope it will also help us develop an understanding of what do we need to study more, where are the highest, yield directions, what are people most bothered by. That would help direct us in terms of what to start with first.
Okay. Now, I have, we mentioned off the top, I mentioned just in Quebec alone that high number of people, as many as over 300,000, right? But I have read that around the world where this is still very much an issue because people suffered from COVID everywhere. There are other studies or have been other ongoing studies. Do you follow those? What has anything been learned from any of those?
For sure, we've learned a lot. Definitely, there's some really good research being done in lots of places, and we're hoping to be part of that effort. We don't think we need to come up with answers all by ourselves in Quebec, but we do think it's important that we understand what's going on here. So we are definitely learning about this. We're learning that a lot of the symptoms are what we would call in medicine non-specific, that they may be seen in lots of different conditions. Things like fatigue, things like trouble concentrating. These are symptoms we see in many health conditions. So that's an extra challenge. Is what's going on related to long COVID, or is it just a coincidence? We also are, learning about the more severe end of the symptoms and what can be offered there. I think we maybe know a bit less about the less severe symptoms. There may still be problems for people. It's possible that maybe simple self-management steps, good advice that we've been giving people with other conditions and similar symptoms, it might help people who think they have long COVID, especially if they're not really severely affected, if they're not in bed or really wiped out by this. Maybe there's some things we could tell or advise that could help people feel better. And that's something that we're trying to study. Are there simple measures, simple steps, simple changes in lifestyle, for example, that could help people feel better? We'd like to figure that out because if we could do that, that would potentially have a big impact. Okay.
For people who do want to get involved, you mentioned it's all online, which is great. I think for a lot of people, that'd be a very convenient way to do this. You said it's okay. Anybody who wants to do this, who feels they have something that they consider long COVID, can get involved. So what's the easiest way to do it?
So if you're over 18, you live in Quebec, and you've had symptoms that you think are related to your COVID infection that lasted more than a month, you're probably eligible for our study. You go to the website post-covid.quebec and contact us through the website, and we'll be in touch with the next steps. It's important to know that just clicking that button on the website just puts us in touch with you. It doesn't commit you to anything. Before you start in the study, you have the chance to read the full consent form and understand what we're expecting from you, and so at that point you can decide if it's right for you.
Okay.
Excellent. And it's all online, right? The entire study takes place online. No one
That's right. It's all online, and it certainly doesn't replace medical care. If people are feeling that they need a clinical opinion, they need to seek out that advice from their clinical health care.
To repeat, post-covid.quebec, right?
That's right.